What's up, Human Phys class? This is section 4 of the respiratory system dealing with controlling of breathing. This is the absolute last video you have to watch. So if you've been sick of listening to my voice through these, I'm sorry. If you've enjoyed it, awesome. I apologize for my absence over the last 2 months. It's a busy couple months, and I know it's difficult for you guys, but I appreciate those who stuck with it and adapted to the way this class has evolved. So this last section, we're going to talk about how our body controls breathing. It's going to be very short. We know that breathing is an involuntary act, and the muscles are under voluntary control. So basically what I want you to know is that if you hold your breath and pass out, most likely your body will start breathing for you again because it's an involuntary response. Do I want you to do that? Absolutely not. But I just want you to understand that you do have control and we can hold our breath, but it is an involuntary act. So let's kind of blend some of the units in terms of what you learned so far in this class. We're going to try and incorporate a little bit of the nervous system. In the last section, section 3, I focused on talking about something called the phrenic nerve and how you can see how it's attached down to the lungs and the diaphragm. And it does move kind of right up into the medulla oblongata. And that's where our respiratory center is actually located. So if you take a look here, there's a section of our spinal cord called the medulla oblongata. And it's responsible for some of the neural factors that control breath. So if we have an increase of, of CO2 or a decrease of oxygen in the blood, this will trigger the respiratory center and specifically this medulla oblongata. And neurons in the brain that control inspiration and expiration will begin working. Where would this be common? Hyperventilation would be an example I'll talk about in a little bit, where we have excessive breathing. And that would be an example of how the medulla oblongata would not only sense these things, but also trigger some type of response. And it's going to send that signal down the phrenic nerve, which is going to work with the diaphragm. And based off of section 3, you should know what kind of role the diaphragm plays in this breathing process. It's very, very important. So a lot of times what will happen is if you have a decrease in oxygen, the medulla oblongata will sense that. It'll trigger the diaphragm through the phrenic nerve to start to contract, which is going to drop down, increase the volume, go through the whole process of inhalation, and will inspire and expire the air. So that's kind of our fail-safe method. This is what makes it involuntary, is basically what I want you to know. So not only do we have some neural systems in place, we also have some chemical factors that our body really depends on. Our homeostasis, our stable internal environment, is very important, and breathing is a very important job in that. And it depends on the levels of CO2 in the blood. So if there are high levels of CO2, that respiratory center will kick in versus if there's low levels of CO2. And we actually have chemoreceptors in our aorta. Now I want you to take a second. Why would we have it in the aorta? Well, that's an area that's going to have some of the highest pressure and some of the most blood moving through it. So we're going to look for certain chemicals. And obviously CO2, carbon dioxide, is a chemical. Oxygen is a chemical. And we have these receptors in the aorta and a lot of the carotid arteries. And they'll be sensitive to the amount of blood oxygen. And basically what you need to know is that we have the ability to test the waters. And by waters I mean blood. But your body can sense, okay, hey, you're kind of low. And that is going to be the major working parts of how we neurally receive that information. So these chemical receptors would obviously send signals up the spinal cord to the medulla oblongata, where it would process information and send out a response through that phrenic nerve. So a lot of things in place to ensure that your CO2 and oxygen levels are where they should be. So I have some big words for you, and these are types of respiration. You may have heard of some. You've probably could go through these words by now and in this class, recognize a lot of root words, a lot of vocab development that we've gone through. But if you heard the words apnea, example, sleep apnea, that means no breathing, the word apnea. And sleep apnea, to speak on it a little bit, really deals with the fact that people who are overweight have a lot of pressure on the windpipes, and sometimes there's so much weight on it that the windpipe can collapse shut, and that's considered sleep apnea. And what essentially happens is you have a big long breath, and then all of a sudden you breathe it out, all that weight comes down, close the pipe, and the person is just not breathing for an extended period of time. Now, a lot of sleep apnea patients can live with sleep apnea and not even have any, breathing treatments or any medication. And essentially, what happens, the body will actually push open and force air over that closed pipe and reopen it. But there is always that risk factor that pipe will close completely, and therefore you would die. Dyspnea is another one that's difficult or labored or painful breathing. So you might have an ER nurse come in and say the doctor, patient is suffering from dyspnea, and he would know that as, okay, there's some difficult breathing. Either there's some issues inside of the lungs, the air pipe, something like that. Hyperpnea is an increase in depth and rate of breathing, abnormal exaggeration of respiratory movements. This is super common with people who suffer from anxiety or panic attacks. They start to breathe a lot, and their depth is very deep. The rate of breathing is very strong. It's exaggerated, and that's on the borderline of something called hyperventilation. Another one is orthopnea, which is difficulty breathing when in a horizontal position. So lying flat on your back, you have difficulty breathing, and that can deal with a lot of things. There might be an excess amount of fluid. There might be a tumor pushing on it, but your breathing is labored on your horizontal side. And then tachypnea, which is very similar to tachycardia, and that's rapid, shallow breathing, as compared to something where we have deep, exaggerated breathing. In hyperpnea, tachypnea is rapid, shallow breathing. All right, last slide, and I'm just going to kind of go through and talk what hyperventilation is, because that's kind of the most common things. You will note this person breathing into a bag. That's not just something you see in the movies. That's actually a very common way of stabilizing your blood pH, your homeostasis, and that's rapid breathing causing the body to lose CO2 too quickly. And in blood, CO2 decreases, which leads to alkalosis, which we talked about. That's dealing with the blood pH. So what can we do? Well, we can breathe into a bag, and essentially what that's going to do is it's going to bring that CO2 level back up and make it more manageable. People who hyperventilate are basically sucking in too much oxygen. So if you put all that air into a bag, you're breathing out and breathing in CO2 and leveling that back out. So what I want you to do is imagine this person doesn't have this bag, and they're breathing very, very heavily. They're putting more and more and more oxygen into their blood, a lot more than they want, which can lead to alkalosis. So what you do is you breathe into a bag. And as you breathe out, you breathe CO2, and there's no new oxygen coming in here. So the person is essentially just bringing those levels back to normal. So symptoms of hyperventilation would be dizziness, possible fainting because of your oxygen levels. And this is really, when we say RX, that's kind of the doctor's orders, the prescription. Have a person breathe into a paper bag. It's very simple. So it's no joke. It truly does work. And if you ever find yourself hyperventilating, use this method. It will level up the blood pH, and you will lose the dizziness and feeling of fainting, and level everything out. So that's the absolute last video. Thank you again for moving through this process. I know it's been difficult with me not there, but I appreciate you putting in the time. Hopefully you learned a little bit of something about the body throughout these units. And keep me in mind in the future if you ever have questions. Like I said, I'm obviously biased to the sciences, but I hope you find something passionate that you want to do. And if you ever need any help in the future figuring out how to pursue that, you just let me know. I might be happy to talk about it. So with that said, make sure you guys study through your notes, study through your worksheets that you've done on this unit in your lab, and we'll be ready for a test the next couple days. All right, that's everything for now. Yago out.